Some of the more recent advances in breast preserving surgery is attention to detail and the placement of the incision on the breast so that it's in areas which are cosmetically less noticeable without compromising the most important part, which is cure of the cancer and treatment of the cancer. The other specialists that we use when we're talking about breast preserving surgery and breast conserving management would be plastic surgeons, medical, and radiation oncologists. The treatment of breast cancer is no longer just surgery alone or radiation or chemotherapy, but it's an integration of the multimodal management of breast cancer that actually helps to get the best results, primarily from a survival standpoint as well as a cosmetic standpoint. Alaska Surgical Oncology works closely and hand in hand with dermatologists for the management of complex cutaneous malignancies, including melanoma. Typically, the patient will be seen by his or her primary care physician. Either a biopsy is done by the primary care physician, or the patient is referred to dermatology, who typically does a biopsy. A diagnosis is made, and once a diagnosis is made, we then see that patient in consultation if consultation is needed or expertise is needed once evaluated by the dermatologist. So Alaska Surgical Oncology is a resource for primary care providers, dermatologists, and gastroenterologists and other providers for the help in management of solid organ tumors, whether it's esophageal, gastric, pancreatic, liver, colorectal, or melanoma in breast. We're a resource in which we can provide assistance as far as the workup and the surgical and multidisciplinary management of some of these complicated malignancies. We have an educational piece that helps give some background to the recommendations for screening for some of these malignancies. If malignancies are diagnosed, then Alaska Surgical Oncology remains available to see those patients in a timely fashion to help guide their treatment, which could include multiple specialties, including medical oncology and radiation oncology, as well as surgery, for the best outcome and best survival for those patients. We look at the multidisciplinary management of cancer, utilizing all the tools that we have to get the best outcome for that patient to improve survivability, functionality after treatment, and return to normal activity as soon as possible.